Good morning to all of you. So in this video we will covering the topic which is dental liner. We will discuss about their advantages, disadvantages, indications and contraindication and what material we are using as a dental liner. Okay, so get started to the video and discuss all these topics.
So what are dental liner? Okay, so dental liner are the materials that are usually placed in a thin layer over the exposed dentine. So what we do here, we place a very thin layer of dental liner over the exposed dentine. Okay, so when we use it when the dentine thickness is less than 2 mm. Okay, less than 2 mm but more than 0.5 mm. So when this dentin thickness is less than 2 mm and more than 0.5 mm, then we use dental liner. What are their functions? So first is dentinal sealing. Okay, it prevents the tooth decay by seal the dentinal tubules. Okay. Second is pulp protection. Pulp protection, it protects the pulp against various types of chemical or mechanical stimulants. Third is our thermal insulation. It reduces the heat transfer to the pulp. Okay, so it protects the pulp against the thermal stimulants. Okay. So fourth is our stimulation of formation of tertiary dentine. So what is tertiary dentine? Tertiary dentine plays a role in healing the tooth along with the new material formed which will protect the pulp chamber, therefore protect the tooth. Okay, so tertiary dentine forms the new dentine. Okay. So material used as cavity liner are glass enamel cements, zinc oxide eugenol cements and calcium hydroxide. Calcium hydroxide are the most used one as a cavity liner. Okay, so know about a calcium hydroxide as a liner. Okay, so we use mostly calcium hydroxide as a liner. So what are the calcium hydroxide? Okay, they used as liner and available in two forms. One is paste form and second is our light cure form. Okay, so important point to remember here is what we have to know one thing here, that we know we are talking about the protection of pulp. Okay, and we have to use such material that would not irritate the pulp. But do you know what we normally use, which is calcium hydroxide, is highly irritating to the pulp. Okay, why it is highly irritating? Because its pH is 11. Okay, which means it is alkaline. Okay, so here the question arises that why do we use calcium hydroxide if it is irritating? Okay, so what happened here? I am making a diagram of the tooth. So this red color is our pulp and we apply here, this yellow color is our liner. Okay, so what happened here when we apply this calcium hydroxide as a liner on the cavity preparation, it absorbs some amount of water. Okay, it absorbs some amount of water from what? It absorbs from the dentinal tubule. Okay, it absorbs water from the dentinal tubule or from the moisture present in our teeth. So what happens when it absorbs this water from the dentinal tubule, it will releases the calcium ion. Okay, it will release the calcium ion which will stimulate the formation of reparative dentine. So what will they do? They will form a new odontoblast which will later let down a new dentine over the pulp. Okay, so this is happened here that a new dentine is formed here. Okay, so this is why we use calcium hydroxide as our cavity liner. Okay, because it forms new dentine too, so that they can protect our pulp. So this is all about why we are using this calcium hydroxide as our dental liner. Okay. So now we will talk about the compositions of the calcium hydroxide. Okay. We know they are supplied as either toothpaste form or either light cure form. So first we will talk about the composition in toothpaste form. First is catalyst and base. Okay, catalyst barium sulfate, titanium oxide and methyl salicylic. Base calcium hydroxide, zinc oxide, butyl benzene sulfonate. So these are the composition of paste form. So in light cure, there are urethane, dimethyacrylate, calcium hydroxide, and our barium sulfate. Okay, so what are the properties of calcium hydroxide? They are low thermal conductivity. They have low thermal conductivity, stimulate production of tertiary dentin. pH is alkaline, bactericidal property, and this is highly soluble. So advantages is easily manipulated stimulation of tertiary dentin. Disadvantages are moisture sensitivity, and they have low strength. Okay, they have low strength. So these are the advantages and disadvantages of calcium hydroxide. Now we will talk about zinc oxide using cement as our liner. Okay, so as we know zinc oxide usinol, it's so less effect on the pulp. Okay, it's so very less effect on the pulp, but nowadays they are not used as calcium hydroxide shows better property than the zinc oxide usinol cement. Okay, so now know that if you are using zinc oxide usinol, then do not use it over the composite restoration because it reduces the bonding property. Okay, now we will talk about the manipulation for the cavity liner. We know it is supplied as two paste material, paste form, sorry. So this is our toothpaste. What we will do? We will dispense this paste. Okay, this is our paper pad. We will dispense equal volume of both catalyst and base paste. Okay. Then what we will do? We will mix it in the circular motion until a homogeneous color is achieved. Okay, we will mix it in 10 to 15 seconds. Mix it for 10 to 15 seconds. And then when the homogeneous color is achieved, we will load this liner on the instrument for carrying toward the cavity. Okay, so we have to load this liner on this instrument, and then we place this loaded liner on the deepest area of the pulpal floor. Okay, this is our tooth where we have prepared the cavity. This is our tooth where we have done our cavity preparation. So what we have to do? We have to place this liner on the deepest area of the pulpal floor. So this is all about how we use liner, what material we are using in the as liner. Okay, so this topic is over now. I hope that you all understand. So this is our tooth, and this blue color which we are placing here is our liner, and this red color is our pulp. Sorry, this blue color is our base. And what we are placing here in the yellow color is our liner. Okay, this is our cavity liner. So this is all about cavity liner. This topic is over now. Hope you all understand this topic and all the topics. Thank you. Do like and subscribe this channel if you are new to this channel.